Honest talk on what I didn't have the time to, on what that really means. Okay, hey folks, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas, and I want to talk to you today about time and priorities and all of that good stuff. It's some honest talk, and it's based all on about 23 years in the healthcare business and over 48 years of life. We all seem to be short on time, don't we? Emails, notifications, pings, bells, chimes, and phone calls, and that's just to name a few things. It seems like we're always on call, and we're expected to respond, aren't we? Everybody needs our attention, and that goes for our actual jobs, but it goes for our personal lives too, right? Social media alerts, if you allow them, I don't, but social media alerts alone, they're enough to make a person insane. So when someone says, I just didn't have the time to. Well, you want to believe them, right? Because it makes sense. Life has just gotten really busy and more complicated than it's ever been before. And as a side note, weren't computers and technology supposed to make our lives easier? They didn't. But then you remember that people still make time to go to the movies. They make time to go out and eat. They make time to go to the park with their kid, or at least they should be. And when it comes to observing my own kids and their actions, well, they make time for friends and sitting around on their phones or lounging around and watching TV or whatever. My point is, time is available. It may be in short supply for some of us, absolutely. Some of us are truly busier than others, but time is most certainly available. I heard a saying once, and it went like this. Saying that you didn't have time to do something is just a less abrasive way of saying that it wasn't a priority. I didn't have time to means it wasn't a priority, basically. And that hit me just right between the eyes because it's so very true. And I've seen this in my kids and my acquaintances' actions, and I've seen it in my own actions. When I'm interested in something and when I really want it or want to learn more about it, I can usually make it happen. I find that time because it's a priority. It's a focus, and our focus goes where our energy flows, or something just like that I'm sure that came from Tony Robbins. I don't know. But when I want to get better at one of my hobbies or a new interest or whatever, I obsess a little bit about it and I make the time for it. So when a patient tells me that they haven't had the time to come in and address that back or that neck pain, well, sometimes it's true. But many times, if not most times, what they're really saying is that it just wasn't a priority yet. Pain's a heck of a motivator, right? So sometimes if it's just not hurting quite bad enough, it's not the priority. If a patient tells me how desperately they want me to help them get out of pain, yet they tell me that they haven't had the time to do 5 minutes of exercises daily to help get them better, well, it's usually because getting rid of the pain wasn't important enough to make the exercise a priority. My point is, when it's important, we make it a priority and we make the time. We just get it done. At Creekstone Integrated Medical Clinic here, we recommend a short trial of consistent care combined with at-home exercises and self-management. We give our patients the knowledge and the tools to change things, partly on their own. But we can't make it a priority for them. One thing I tell patients about exercises is that there's one guarantee that I can make you on exercises, and that is that those exercises are going to do you no good whatsoever if you don't take the time to do them. I can guarantee that 100%. Fortunately, most of the time when going to an office like ours, the control is still in the hands of the patient as opposed to a surgeon's office, right? Once surgery is necessary, well, the patient really has no more control and pretty much no choice. Their choice is no longer theirs. It has been taken out of their hands for the most part. My point is, stop using a lack of time as an excuse to not take care of yourself. Take care of yourself on your own timetable, right? In advance of issues. Instead of waiting until after it's too late and you no longer have a choice of what is a priority and what is not. Neuromusculoskeletal issues can be treated and controlled non-surgically. And that goes for any patient, no matter how long the pain's been going on, but certainly when addressed early on. So make it a priority. Make the time. Okay? Again, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas. If you're watching on YouTube, hit that subscribe button, leave us a comment, and share with your friends and family. If you're watching on Facebook, make sure you're hitting the like button, leaving a comment and sharing. We all know that's how social media and information works these days. We sure would appreciate your help, and I appreciate you for watching these videos. If you're from the Amarillo area or you're going to be passing through our area and you need to be seen, just give us a call at 806-355-3000. We can get you on the schedule. Until next week, take care. We'll see you then.